Hello, my name is Sulina Powell. I'm an LPN to BSN student at Indiana State University. This presentation is for my community health class, and it will be covering postpartum depression. The learning objectives that will be covered in this presentation is that the viewer is going to be able to identify symptoms of postpartum depression, be able to distinguish between postpartum depression, baby blues, and postpartum psychosis, be able to identify postpartum depression in men, name what treatments are available for baby blues, postpartum depression, and postpartum psychosis, and also be able to name at least 4 resources that are available for postpartum depression. But first, please hit pause on the video and take some time to do the pre-test. In the description, click the link and take the test. After the 3 trimesters in pregnancy, there is a 4th stage of labor, which is then also further divided into 3 phases. The first phase is the first 6 to 12 hours after the baby is born. This is a critical time where mothers are at increased risk for hemorrhaging, eclampsia, amniotic fluid embolus, and uterine inversion. They are monitored very closely in the hospital to try to prevent any of these complications. The second phase is usually, it occurs simultaneously with the first phase, but it can last 2 to 6 weeks. During this phase, the body is undergoing so many changes that affect the mind and the body as your body tries to revert back to its normal pre-baby state. Between this phase and the third phase, which is a delayed postpartum period that can last up to 6 months, is where I'm going to place my focus on during this presentation, as it is during these phases that concerns of postpartum depression arise. The baby blues usually happens 2 to 3 days after baby is born and can last up to 2 weeks or so. However, baby blues normally do go away on their own, and it's not as serious as postpartum depression. So some of the symptoms that you might see in someone having the baby blues is just emotional highs and lows. They're angry, sad, crying. They get moody, cranky, anxious. They have trouble sleeping and have very poor appetite. They also have trouble making decisions, feeling like a failure, or just sometimes that feeling of being overwhelmed. They also feel alone. They might not be alone, but they certainly might feel that way, especially as friends kind of distance themselves a little bit during this stage, and also having problems concentrating. So either way, even though this is not as serious and it does go away within about 2 weeks, it is important to follow up because baby blues can actually lead into postpartum depression, and that can be very severe. So what is postpartum depression? This is where things get very serious. Postpartum depression oftentimes gets missed and confused with just the baby blues. But as you can see from this list of symptoms, this is very serious and requires immediate attention. Let's just go over some of these. These moms are experiencing severe mood swings. They're crying nonstop to the point where they're inconsolable. This also interferes with a lack of baby bonding. They're withdrawing from their loved ones. Their appetite is just shot. Insomnia, or they might be sleeping too much. Then there's that overwhelming lack of energy and lack of pleasure in doing anything. They get very angry and easily irritable. They feel like a failure. They're hopeless. They get severe anxiety and panic attacks, even to the point of thinking of hurting themselves or the baby. And constantly these thinkings are, they start thinking about death and suicide. These feelings can and will interfere with your daily life, but can also interfere with taking proper care of a newborn baby. And although postpartum depression usually develops within the first few weeks after baby is born, moms can start experiencing these symptoms later on in their pregnancy. And it just gets worse after the baby is born. So here are some of the male postpartum depression symptoms. Again, it's very similar to the female postpartum depression, but I just wanted to go ahead and bring knowledge that it's not just the women who suffer from postpartum depression. So in men, you're also going to be seeing the extreme change in appetite, fatigue, sleeplessness, irritability, brain fog, and excessive worry. So I'm sure you want to know what causes postpartum depression. However, there isn't a particular cause of postpartum depression, but the physical and emotional changes occurring in the body do contribute to this issue. On the physical aspect of it, after childbirth, hormone levels such as estrogen and progesterone drop dramatically. The thyroid also plays an important role here as it tries to adjust to pre-baby status. So as the hormones produced by the thyroid drop, it can cause the feelings of being depressed, tired, and easily exhausted. Then when you look at the emotional aspect of it, anyone who is sleep deprived and constantly has to do something can have mental shifts, and this can definitely interfere with decision making, ability to solve minor problems, just from being so exhausted. This can also interfere with appetite because when baby is sleeping, you are left with a decision to eat now or sleep now. So you feel anxious, you feel unattractive, and also you feel like you have no sense of identity, no sense of self. And in terms, you feel like you have no control of your own life anymore. So while there isn't a definitive cause of postpartum depression, you can see where these issues can definitely play a major role in it. I also wanted to just quickly cover postpartum psychosis because although it's a rare condition that can happen within the first week or so after having a baby, postpartum psychosis is extremely severe and requires immediate attention and treatment. Some of the symptoms that they'll have is being disoriented and confused, obsessively thinking about baby and feeling very paranoid, having delusions and hallucinations, sleep disturbances such as insomnia or vivid nightmares, vivid dreams, severe mood swings, excessive energy and agitation, and attempts to hurt themselves and even attempts to hurt baby. There are treatments for each. For the baby blues, although it might not require any treatment, psychotherapy can be very helpful anyway. In speaking with a psychiatrist, psychologist, or any other mental health professional, they can assist with coping mechanisms and setting goals. For postpartum depression, psychotherapy is highly recommended as well as taking antidepressants. The specialist will make sure to prescribe something that has very little side effects for the baby, as these medications do go through breast milk in very small amounts. However, in most cases, the use of antidepressants do outweigh all risks. For postpartum psychosis, there will be a combination of medications prescribed to treat the many varying symptoms, such as antipsychotics, mood stabilizers, and benzodiazepines. There might also be a need to do electroconvulsive therapy only if medications haven't been effective. So with ECT, it induces a small seizure via small electrical currents that are sent to areas of the brain. This will cause changes in the brain chemistry, which then directly affect and reduce the symptoms of psychosis and depression. This is just a short list of what is available as a resource. The crisis text line is an amazing resource to have, and it is completely free. It is supported by community donations. You'll be in touch with certified counselors that are available immediately. So by texting home to the 741-741 number, you'll be instantly connected to a crisis counselor. The Postpartum Support International is another readily available resource. You can actually call or text help to this number. You just leave a message or you drop a text, and a trained caring volunteer will contact you right back. This website also offers support groups for other moms or dads that are dealing with postpartum depression. They will also provide you with many available and local resources to support you through this journey. The National Alliance on Mental Health Illness incorporates more than just postpartum depression, as they also deal with other mental health illnesses as well. But it is a nice resource, especially if you have more than one mental health crisis currently going on. They are available by phone and by text, but also by visiting their website, you can chat with a crisis counselor or also use other resources available on their website, such as group meetings that they have, and you can do those in person, or you can do it over the phone, or you can do it like through a Zoom meeting. It's actually really neat. And then, of course, there's the National Suicide Prevention Lifeline, which is also available if you're experiencing any suicidal ideations. They are available 24/7. So again, these are just some quick resources that are available to use even from the comfort of your own home. But of course, there are many more resources available for postpartum depression. So please note that you are not alone. Someone is always available to help you through this. These are the credible references I used to put this all together. And so this now concludes my presentation on postpartum depression. I hope you were able to take away from it and find it resourceful. Please take some time now to take the post test and see how much you've learned. Thank you so much for your time.